Welcome to On The Beat, everyone. I'm over here with Dr. Thakker from Monroe Regional Hospital, and today we're talking all about internal medicine, but I also wanted to sit down with Dr. Thakker and find out why he chose the wonderful state of Mississippi to do his medicine. Welcome to the show, my friend.
Thank you very much for inviting.
Okay, now, you're brand new here to the state of Mississippi.
Yes.
Why did you decide to come here?
Well, I grew up in India in a small town, and naturally we have hot weather rather than having cold, chilly weather. So, and I'm taking care of my parents. They also decided to, I want to take care of them. So naturally, I wanted to move to South, and this opportunity come up, so that I moved to the
So where did you end up coming from, though?
New York.
And you said to me off camera that your parents were like, we're moving to Mississippi because it's much warmer.
Yes.
Okay, so let's talk a little bit about, and you're in Aberdeen.
Yes.
At the hospital there as well.
Yes, yes.
Let's talk a little bit about internal medicine, shall we? So for people at home who, we hear lots of terms and descriptions about medicine in general. What is internal medicine?
It's the caring for the patient above the age of 18 until the 100 plus, whatever.
Really?
Yes. So all the internal medicine physician takes care of all the organs. They are not specialized. They are specialized only in taking care of those adult patients. That to diagnose, to screen, and then to prevent the medical problems down the road.
Okay, so let's talk a little bit about some of the services that you're doing over there at the Monroe Regional Hospital in Aberdeen, because there's also a clinic there, correct?
Yes.
So let's talk a little bit about what's possible there at the clinic.
Well, I'm taking care of the patient as an outpatient as well as inpatient care at the Monroe Regional Hospital. For the outpatient, patients naturally set up the appointment for their chronic problems or the acute problems, or for any semi-emergency cases, then they come to the office, I examine and then take care of them. If it needs to be referred to this higher specialty services, then I refer to the higher specialty services. Or if they get sick and then they come to the emergency room or gets directly admitted, then I take care of them in the hospital.
So, okay. Fair call. I want you to just tell people at home, because I often think about it, is dietary enough to stay healthy if we change our diet? How do we lead a much healthier, satisfying life, in your opinion?
Diet is one of the factors, but getting the screening exams done by the physicians every year, and the American Society also recommends to have the physical done after the age of 40 every year, and then certain examinations or the certain testing to be done for the preventive aspect, so the patients don't develop any serious health issues down the road.
And I think that's something, Dr. Thakker, that people forget, the yearly examinations.
Yes.
I want to ask you also, why do you think men don't go to the doctor as much?
Well, very good question. Man thinks that they are more of stronger. Superman. And naturally they are healthy, or they don't want to go to the doctor, whether they are shy or whether they don't have time, or if they are very busy, or they think that they are very healthy or not taking any medicines routinely, then they think that they don't do that. But I advise strongly that is to have the physical done regularly, get certain tests done regularly, so that it is healthy and avoid any problems down the road.
And at what age one should be looking at those type of things as well?
Normally after the age of 50.
Yeah.
But it depends upon the certain diseases, then you can start that earlier age too.
If you want to find out more information about Monroe Regional Hospital or Dr. Thakker, there it all is up on the screen. Give them a call. He'd look forward to seeing you very soon. Back after this short break.